Hello, my name is Troy Yoakum. I'm going to be presenting a patient for advanced practice clinicals, nursing 5472. Chief complaint for this patient is difficulty breathing. HPI Mr. GG is a 68-year-old Hispanic male who arrived to the emergency room on 8/31/2019 for difficulty breathing. The patient was starting to have difficulty breathing 2 days ago, unable to clear his secretions, requiring frequent oral suction at home by his brother and caregiver. The patient is a quadriplegic due to a motor vehicle accident 10 years ago and has multiple episodes of pneumonia with hospital admission in the past. Past medical history, in addition, is the motor vehicle accident 10 years ago, pneumonia, hypotension, and malnutrition. Surgery for this individual, past surgery, is spinal fusion. He had a liver laceration with repair and a bowel resection. Also a left and arm and leg fixation. And this was all as a result of the motor vehicle accident 10 years ago. Current medications. He takes a multivitamin daily, Colace 100 milligrams daily, lactulose 50 milligrams PRN for constipation. He takes Ensure with every meal due to his malnutrition, and he also takes Midodrin 10 milligrams TID. He has no known allergies, no family history. Social history, he has no tobacco, no alcohol, or no illicit drug use. He is bedbound. He's 100% disabled. His care is provided by his brother and then a caregiver when his brother's at work. ROS, respiratory wise, he's unable to catch his breath. Active productive cough with lots of secretions, thick green secretions. Neurologically, he has no headache, no dizziness, no syncope, no chest pain or palpitations. No constipation or diarrhea, no nausea or vomiting. He does require straight cath every 6 hours. Musculoskeletal, and he's quadriplegic and he's unable to move or function on his own. Physical examination, vital signs: heart rate is 122, blood pressure is 134/57, respiratory rate 33, setting 88% on 100% non-rebreather. Current temp was 37.1 degrees Celsius. General, he's anxious, irritable, very skinny and frail looking. Pupils equal round, reactive. Oral cavity is moist, but it has very tenacious, thick secretions, which requiring the nurse to suction very frequently. And he's unable to clear it on his own, which is new for this individual. He has good oral hygiene. There's no redness or swelling to his neck or face. Cardiovascular wise, he does have has a rapid and irregular heart rate in atrial fib. He has no murmur, no JVD, or no carotid bruise. His nail beds are dusky. However, his capillary refill is less than 2 seconds. His peripheral pulses are +2. He has no edema. Respiratory wise, his upper airways has very coarse crackles bilaterally and gargling in the upper airway, which was relieved with suctioning and diminished at the lower bases. And he is using some intercostal and abdominal muscles with some mild retractions. Skin wise, his skin is pink, dry, and intact. Bowel sounds are present, and his abdomen is flat, non-tender, very skinny. Musculoskeletal, 0 out of 5. He is able to, however, raise his neck slightly. Neurologically, his pupils are 3, brisk bilaterally. He has no sensation, but he is oriented ×3. Diagnostic and labs: WBC is 11.5, hemoglobin is 10.7, hematocrit is 39, platelets is 199, sodium 137, chloride 95, potassium 3.3. CO2 is 23. Glucose is 105. Lactic acid at this time is 0.9. pH, his ABG, his pH was 7.32. PCO2 was 49. Bicarb was 18, and PO2 was 63. Planned assessment for this individual: number 1, acute respiratory failure with hypoxia. Immediate orders for him would be a chest X-ray now, and also one in the morning. We're going to place this individual on a BiPAP with an IPAP of 12, an EPAP of 5, with FiO2 of 100% for now, and wean to maintain his SpO2 greater than 90%. We're going to order albuterol nebs, Q4 PRN for wheezing and shortness of breath, as well as dual nebs, Q6 scheduled. We're going to also order Q2 oral care and suctioning. Keep the bed elevated at 30 degrees or higher. We're going to keep him in NPO for now. He may require intubation. Second is respiratory acidosis with hypoxia and tachycardia, as noted as above. My plan. The third one is chronic urinary retention due to spinal cord dissection and quadriplegia. So we're going to order Q6 bladder scans, and if the volume's greater than 450, we're going to straight cath him. Strict INOs. We're also going to order a urine culture as well. Also, he has hypokalemia, secondary to most likely malnutrition, poor oral and intake. We're going to order potassium chloride 40 MEQs IV piggyback, and then we're going to do a CMP in the AM. Additionally, chronic malnutrition due to poor oral intake. We're going to also order him D5NS continuous at 60 cc's an hour until we decide if we're going to keep him NPO or not. Once we get ABGs after the BiPAP. Also, put him on GI prophylaxis. We're going to put him on pantoprazole 40 milligrams IV push daily. We're going to put SCDs on for VTE prophylaxis, and this individual is a full code.